Hi, I'm Carla Clawson. This is my moral dialogue, universal healthcare versus private insurance for ethics and moral problems, philosophy 201G for spring semester 2021. Today is February 20th, and I will be speaking like this for speaker one, who is pro universal healthcare, and like this for speaker two, who is pro privatized healthcare, or just the way things are. Okay. Universal healthcare is better for patients and the healthcare industry. Healthcare as it is now is better than universal healthcare. Universal healthcare is a system used by every other developed country in the world. Healthcare should not be a choice someone has to make in terms of affording care. Care is a fundamental human right, and we all have the right to thrive physically, and by privatizing healthcare, we as a country effectively limiting access to quality care for those of poor economical standing, or for people of color, or for people who work in small businesses who don't offer healthcare options. Private healthcare is a system in the U.S. What does it matter what other countries do? Do other countries live in the wealth of the U.S.? No. It's an American right to choose our plans and care, and in a universal system, all care would be lower if we're all seeking a truly even system for all. Think of the wait times. If anyone could just waltz in and get care for whatever frivolous concern that they had, by making people partly financially responsible for their care, it teaches them to really evaluate how ill they are before using up healthcare resources. I think that universal healthcare that is tax funded would bring the greatest amount of healthcare to the greatest number of people, improving overall health of the whole country and improving our societal outcomes as a whole. I disagree. It just brings healthcare to a certain group of people. Most people today have healthcare through their jobs. According to the U.S. Census Bureau, in 2019, 26.1 million people in the U.S. did not have health insurance at any point during the year. 26.1 million is a lot of people who are uninsured. And a universal health system would bring that number down to zero. Everyone would have access to care. Not just everyone who has a job or a job with benefits. And what about people who work part-time or are freelance? And don't they deserve health care too? They have jobs, and those jobs don't offer them health care. Taking a job without health care options is their choice. If health care was free, low-cost hospitals and physician offices would be overrun with people who just have a sore throat or a cough, and the people who really need the care are waiting in line just to be seen. As it stands now, most private practice physicians are on a fee-for-service pay model. In plain speak, the more patients they see or surgeries they perform, the more money they make. Which is why your doctor sees you only for 5 minutes. They have to keep their numbers up. Do you really think that that's beneficial for your care? Are you being listened to? As to overrunning clinics and ERs, do you think that people don't know enough of their own bodies and illnesses to seek help when they need it? What about the instances of chest pain? It could be a life-threatening cardiac event. According to the CDC in the United States, someone has a heart attack every 40 seconds. Every year, 805,000 Americans have a heart attack, and about 1 in 5 heart attacks is silent. The damage is done, but the person is not aware of it. So, by those figures, a frivolous complaint of chest pain would not entitle a person to seek care, or would they have to weigh the life-saving care against their pocketbook? If a person is uninsured, then they have to pay hospital bills out of pocket, and this can contribute to further poverty, ruination of credit scores, and collections, continuing a cycle of poverty and the need for government support systems like disability and food stamps. I would be more concerned for the people who aren't getting the help that they need because they would not be able to afford food for their children than too many people in the system. Well, who's paying for all this care? Why should my hard-earned money go to someone who doesn't work or doesn't have the moral fiber to earn their own way? America was founded by ideals of a free market, of rugged individualism, and anyone can be anything in this country. And to force everyone to have a one-size-fits-all approach to healthcare is unreasonable. think about the money you pay in insurance premiums. And then think about the amount you pay in co-payments before you reach your deductible. We're the only country that uses a privatized system for healthcare coverage. Technically, you're already paying for people with severe medical issues anyways. Anyone who requires dialysis is automatically qualified for disability payments and for Medicare, which are both taxpayer funded. So not only are you paying for a for-profit insurance company to deny your claims repeatedly and with the hope that you will just pay for the service and give up, you are already paying for Medicare and the disability for those unable to work or who have cerebral palsy and live in a home. Why are we paying insurance companies and Medicare all at the same time? If you only paid more in taxes, you wouldn't be paying premiums and out-of-pocket expenses. So I'm paying for people with disability now, but what about non-emergent treatment or elective procedures? How would those figure into the system? What if somebody wanted to get breast implants for no medical reason? How is it fair that I should pay for someone to get better boobs? Elective surgery for non-medical or purely cosmetic reasons is not covered in countries with a government-funded or universal healthcare system. Well, we have the best medical care in the world. Isn't it true that our country has one of the highest rates of cancer survival? According to an article from Forbes, America has been among the best cancer survival statistics because of an incredible abundance of high technology, equipment, and drugs, and more extensive screening with more extensive treatment. I mean, if we're the best, why would we change it? If it's not broke, don't fix it. We may be the highest in specific areas of care, but overall, we're not doing too great. Look at Sweden. Sweden boasts high life expectancy rates, 79 years for men and 83 years for women. High cancer survival rates, as well as one of the lowest infant mortality rates in Europe, with an average of 3 deaths per 100,000 children born. We are currently the country with the lowest life expectancy. Our life expectancy is 78.6 years, whereas Japan is 84.2 and France is 82.6. We cannot say that we have the best care. Well, I mean, hospitals employ a huge amount of people. They think a job loss to the economy. What if things take a downturn and taxes aren't getting the level they need to cover all this care? The government gives tax breaks to businesses all the time. If nobody big is paying into this, then won't hospitals close? People would lose jobs. Just because hospitals would all be nonprofit and funded by taxpayer money doesn't mean that jobs will be lost. In fact, most other countries with a universal healthcare system have more physicians per capita than the U.S. We aren't getting better care overall, we're just getting more expensive care. The government doesn't have to give tax breaks for everyone in business. We vote to elect leaders who won't bend to big pharma or corporations in the way that we've seen. Maybe things can change. How can we trust a government who continually takes election finance money from pharmaceutical companies to make the right choices for our care? How can that ever be ethically legitimate? We can make ethically respectful laws and borrowing money from large businesses and pharma companies from corrupting elections. And after the last 4 years, haven't we learned that business and politics aren't always the best combination? Medicare is an existing framework for a universal healthcare system, as is TRICARE, which is the active retired military healthcare system and different from the VA. Medicare might not be perfect, but if we as a country put time and effort into actually fixing the laws to improve it, it could serve all of us rather than just being an afterthought for retirees. Private insurance exists in other countries as an extra. If you really feel you want to spend more money on that, then that should be an option to you. This is America, and that is the basis of America's freedom of choice, so choose to have more. But don't deny others the basic human right because you think that they don't work or don't deserve it. I don't want to deny anyone anything. I just don't want to end up financially responsible for someone else's poor health choices. You're already paying for it and put money into the pocket of an insurance company whose only concern is their investors' profits. And a lot of people make mistakes in life or have problems, but you're paying for that already. In Medicaid, which is greatly needed health coverage for economically challenged. And right now, our whole system is designed to make money for the higher-ups and not always to provide the most economically stable and greatest care. So agree to disagree? I do. I agree to disagree with you. Thank you.